I'm John Parody, Senior Editor and Writer for the VA New England Healthcare System, and I'm here at the Jamaica Plain campus of the VA Boston Healthcare System, and I'm with Dr. Mark Logue. He's an Army veteran and a statistician with the U.S. Department of Veterans Affairs and the National Center for PTSD here at the VA Boston Healthcare System. His research interests include the genetics of brain disorders such as PTSD and Alzheimer's disease and anxiety. He's also an associate professor of psychiatry at the Boston University School of Medicine. He has published works in dozens of academic journals. Some of his research involves the VA's Million Veteran Program. Mark, welcome to our program.
Hi, glad to be here.
Mark, why don't we start off by if you could talk about your service in the United States Army?
Great. So right after high school, I was looking for some way to pay for college. So I thought it would be good to join the Army Reserves, and I signed up and did basic training. And then partway through my sophomore year at University of Oregon, my reserve unit got called up because of Operation Desert Shield. And I actually went to Germany for 3 months. I worked in medical supply, and I worked in medical supply in Germany, helping get a hospital ready for casualties that would be sent back. And after 3 months, I was discharged and went back to my reserve unit.
And your time in Germany and Stuttgart in particular during Desert Storm, Desert Shield, what that involve and what did that include?
So we were really at that point trying to the effort was to increase the capacity of the hospital. So they were taking rooms that were just on the campus and on the base used for other things and bringing in beds and trying to set it up to just increase the capacity. And so I worked on that primarily. And then for a little bit of that time, I actually worked in a warehouse in Pirmasens near the French border as well. Again, just trying to help process the medical supplies coming in just in case there were a lot of casualties in Desert Storm, Desert Shield.
And then you came back home to the Pacific Northwest, and you remained in the Army Reserves, and you separated in what year?
I can't remember when I was officially done, but then I moved from Oregon to Iowa to do graduate work there.
Okay, so early 90s time frame.
Yeah, mid-90s.
And what piqued your interest in going into this academic career field that you're in?
So my undergraduate degree was in mathematics, and statistics seemed to be a good way to apply those mathematics to real world problems. So I liked that it had applicability, and it helped me understand what I read in the newspaper, and it helped me deal with real data and maybe address real problems like health issues and things that I thought just math theory won't let you do.
Sure. Was your time in the Army, was there kind of any linkage to what you're pursuing at the time with your the medical field and medical corps background? Or
that may have played a role. Primarily it helped me get through college, so it allowed me to be able to keep working on my degree.
Sure, that's important, right?
But I don't think I initially didn't start working in PTSD. I started working more in general anxiety disorders. And when I moved to Boston, I started working in Alzheimer's disease. And then I made connections with a few people at the National Center for PTSD here. And we started working on a genetic study for PTSD. They had data and they needed help analyzing it. And then I think that paper was very successful, and it just snowballed from there. And I became more and more involved in PTSD research.
So your work is on genetics, particularly as it applies to those three areas, PTSD, Alzheimer's, and anxiety.
Most of my work focuses around there. So we study genetics at multiple different levels. So there's the genetic variants you inherit from your parents. That's one level of genetics. Then we also look in the cells and look at what genes are turned off and on in the blood and in brain tissue. So we're looking at multiple levels of what's happening with the genes and the genetics.
What's the potential impact from the work that you're doing and the work with the team here at VA Boston with veterans?
So there's one level when we're talking about things you inherit from your parents, and that might be useful for identifying people at increased risk for getting PTSD or Alzheimer's or age-related disorders. There's another level when you're talking about studying the epigenetics or the gene expression, is that's measuring something that's going on potentially right then in the person. And so that gives the possibility of doing diagnostics if at some point based on these genetic assays. Also, there may be genetics may have implications for treatment. So there are cancer drugs right now that are targeted for cancer cells that have a specific genetic profile. And maybe someday, if people have a certain kind of PTSD or depression, we can find the best drug for them quicker, or the best method for treatment.
So a lot of veterans certainly know the U.S. Department of Veterans Affairs for our health care, right, and the clinical care that we provide. But the research arm of the VA is known throughout the world as a leading cutting edge with a lot of the research. Does that also apply in this area as far as the PTS work that's being done within the VA?
Yeah. I certainly knew research was going on at the VA, but didn't know until I joined how extensive that was and how much impact it has. I mean, it's impressive. So there are many different research groups across the country. There's also the big genetic push within the VA right now is sort of embodied in the Million Veterans Program, which is an amazing project where hundreds of thousands of veterans have volunteered to submit DNA samples, and also to allow those to be studied by researchers like me, and have those samples linked to their medical records and fill out surveys and health questionnaires that can be examined. And so we can look for genetic effects for these disorders. And it's amazing in that it's one of the largest biobanks of its kind in the world. There are only a few others, like the 1,000 Genomes Project and well, not UK Biobank, sorry, not 1,000 Genomes, UK Biobank, and a few other projects that are on the same scale. There's a few more coming online, but it's really impressive to have this resource built up within the VA system and allow us to do genetic studies on things that are particular interest to veterans.
How does a veteran get involved with the Million Veteran Program, and how does that work as far as the process?
So I've never been involved in collection, but as I understand it, there are collection arms at many VAs across the country and desks out where you might see a sign for MVP, and there are people out there to talk to you and help you sort of navigate joining. And it just involves taking a blood sample, which gets sent to the data to a core laboratory that's here at the Boston VA, and filling out consent forms and questionnaires about prior studies, and then that data is amassed, and people like me who have an approved project, who have got a grant submitted to study something specific in the MVP data set can access it.
Is there anything that you've seen so far within your work, within the scope of work, that you can share, or anything that is compelling at the moment?
So my project has mostly just got started in the last year. So we're still collating all the data from the medical record. Particularly my project's to look at Alzheimer's disease genes, the known risk variants from other things, and look to see if the impact of those genes is modulated or changed by exposure to head injuries and TBIs or combat stress. So it's looking at if Alzheimer's disease risk is increased by interactions between those genes and severe combat stress. And we don't have results yet. We're when you're working with data like this, you have to, a lot of our data comes from the medical record. And that involves actually going through the medical record in an automated way, because you can't read through 500,000 people's medical record and decide this person has Alzheimer's disease, this person doesn't individually. You have to come up with some computer algorithm to decide who has Alzheimer's disease, who has mild cognitive impairment, who has some other kind of dementia, and validate that and show that your algorithm is working very well. And so we're in that stage where we're developing that, and we've just got a few preliminary diagnoses now with MCI and mild cognitive impairment, so a precursor stage to Alzheimer's disease. And these the Alzheimer's disease genes, and at least we're showing so far that the known Alzheimer's disease genes are increasing risk for mild cognitive impairment in the veterans.
So for the post 9/11 generation, certainly traumatic brain injury is one of the signature injuries and wounds of war for the Iraq-Afghanistan veterans. So a lot of the research you're doing is looking at kind of the intersections, if you will, between traumatic brain injury, PTS, and anxiety disorders, depression, how they all possibly connect. And
yeah, that's the goal. Like now we're of course mostly looking at older veterans if we're looking for things like Alzheimer's disease, but hopefully things we find in those veterans will help the younger veterans that are maybe new to the VA system now.
For the Million Veteran Program, does that apply to veterans of all eras and generations?
Yeah, I think all veterans receiving care at the VA system are eligible to join MVP. And I think there's a pilot program and push now to expand beyond that to veterans who aren't specifically getting care at the VA. Right now, older veterans are overrepresented in the MVP, which is in some ways good for my research looking at Alzheimer's disease and dementia. But in other ways, we'd like to see the younger veterans too. And I think there's a push to get them enrolled as well. And the more different kinds of people you can see in the biobank, the more you're sure that your results are representative.
So you work in arguably the research hub for the U.S. Department of Veterans Affairs, VA Boston, I believe does more research of any VA medical center across the country. How does that make you feel when you come into work every day, knowing that you're coming into a place that you have colleagues that are working towards the same common purpose to help veterans? And it may not be seen immediately from some of the work that you've described, but longitudinally over time, hoping to see reaping the benefits of the good work that you're doing.
I think this is just a great environment to do research. It's amazing how many different things are going on here, and the opportunities for somebody like me that's looking for new, say, data to examine. I was immediately, people were knocking on my door when I showed up and asking if I wanted to be involved in studies and if I'd tried this new kind of data. And so there were just so many opportunities to get involved, which I thought was exciting. We've got the MVP, a lot of the leadership is here, and as I said, the core lab is downstairs. There's also the PTSD Brain Bank is here. Some of those people are right down the hall from my office, which has led to other opportunities. So the research community and the opportunities there are great. It's also, I think, very interesting to be housed at the VA and coming in every day. You see veterans in the lobby and in the elevator, and I think that's motivating compared to being just in your university office all day and only seeing other researchers. We see people we're trying to help on the elevator in the cafeteria when we're having lunch. So I think that's actually been another good reason I'm happy that I came to the VA to do research.
Can you describe some of the collaboration work with the VA here in Boston? You're on the faculty at Boston University, some of the other organizations, agencies, academic affiliations, and how that all plays into the research work that you do here.
Yeah, so I came from Boston University School of Medicine and then joined this full time and still keep an affiliation there. The work I do here is primarily with people in the National Center for PTSD Behavioral Sciences Division. But we have collaborations with other VA centers. The TRACK study, which studies, it's a neuroimaging study of veterans with TBI, traumatic brain injury. So That's just downstairs. So we do a lot of work with them and looking at the veterans with TBI and neuroimaging. And there's also, as I mentioned, the PTSD Brain Bank. We have a project collaborating with them, and then there's MVP. So there's my work reaches out to a lot of other groups within the VA. Then there's also a large genomics effort that's going on in the world, sort of spearheaded by a group called the Psychiatric Genomics Consortium. And there's a PTSD group within that consortium that's getting together tens of thousands of samples outside the VA system of just general population samples and trying to get large scale analyses of PTSD cases and controls there to try to find PTSD genes. And we're involved in that as well. Some of the studies I'm involved in, I work to try to make sure veterans are represented in that consortium and that veteran data is being analyzed and incorporated in the models being developed by those groups.
With all the work that you do here, I imagine you get a lot of visitors.
I actually end up traveling more than I get visitors. Yeah, I'm off meeting with people from Duke to talk about neuroimaging and Emory to talk about epigenetic effects, and I'm off at conferences quite a bit, and those are good places for these large scale collaborative efforts. There's meetings before a lot of research conferences to get all the people together and try to do work. So yeah, I'm out and about quite a bit, meeting with these groups and getting my results.
Would you say there's great interest right now in academia to look at these areas of interest, the PTS and TBI and the gene research that?
Absolutely. So I got involved in this, I think, around 2014, 2015, and the growth's been exponential in the amount. There wasn't a genome-wide association scan for PTSD genes before our paper came out at that stage. And I think since then there's been like 7, or including the one from the Million Veterans program, which was the biggest so far. So it all kind of kicked off and snowballed, and then the working groups started forming pretty much right after that. So it's a lot of active collaborations going on now in this area, and TBI especially as well.
Yeah, so I think for us as veterans, that's really reassuring to know that our nation has taken such great interest in this. You know, for all those of us that have served, that there are folks, very smart, intelligent people that are looking at all the different consequences from war, and with the hope and goal, the result that it'll improve care and our quality of life, so we all live long, good lives. That must make you feel great, you know, from an Army soldier and now working for the federal VA.
Oh, thank you. No, that's great to hear. You know, you write papers and you work away on this stuff, and you know, that's the ultimate goal, and the hope is that someday the work you're doing will have an impact and will be, you know, translatable to care in the hospital, or lead to new knowledge about brain circuits or molecular pathways that allow a new drug to hit the market. And I think that's what we're all hoping to achieve.
So this comes full circle from the time you left high school. And
yeah, it wasn't a planned path, but in some ways it does seem like I've come back around. I was working in medical supply. You know, I was supporting soldiers on the front line, or, you know, trying to, and that was my goal in that job. And then now I'm at the VA, in some ways still trying to support soldiers, maybe in some of the same ones, and help make their lives better and make things easier. It wasn't the plan, but in some ways it felt like coming back to the VA, I had a sense of the bureaucracy and being in the military and the government and the culture a little bit, which made it feel a bit like a homecoming in some ways.
Yeah, sure. You know, and I think also I ask every veteran this question is, some of those early formative years that you've had I'm certain in the Army have had impact on you now, as far as just the very basic things that we all learn through our military service, discipline, right? Accountability,
Absolutely, yeah.
being on time. How has all those things worked for you throughout your career? I mean, going certainly in a PhD program, that takes an enormous amount of dedication and incredible amount of discipline, I would imagine.
I think some of the things you mentioned, definitely the accountability, being on time, the sort of just the sense that you're don't have a normal job and that your actions have consequences, so you just need to get the job done. That's the goal. That sense definitely stuck with me in many ways, and in other odd little ways. They're in basic training. You're trained to check your dog tags and your rifle before you move from one place to the next. And I still, before I leave work, check my ID and my cell phone in my pocket. As I'm leaving the door, I'm like, okay, I've got to do the check.
I do the same thing.
You do too. So definitely, there's my military experience has shaped my my life in all sorts of ways. Not to mention just the great impact of the support for my education and the college afterwards. That was a game changer.
So for the veterans that are out there, or folks that are still active duty or serving, looking at a post-career with the VA, how does that look, and what advice could you offer folks as they're looking at perhaps going into the research arm of the VA?
I just I can't say I had a plan to end up where I am today. So I don't think I'm good at telling people how to plan, but I think it's good just to never stop learning. I think look for opportunities to do new things, to try new things, and to challenge yourself, whether that's a college or just going to the local library or going and finding out, what new restaurants are in your town. Just being out in the world and trying new things and getting out there leads to opportunities you never knew were possible.
Dr. Mark Logue, thank you for the important work that you're doing, VA statistician here at the VA Boston Healthcare System. On behalf of New England Veteran and the VA New England Healthcare System, thanks for all the work that you're doing.
Oh, thanks for having me. This is really fun.